Sally comes back and loves her glasses. She is also worried about the possibility of going blind. She is worried about the cost of the testing necessary. She has been under a lot of stress with her finances, caring for her children, and working overtime. This has led her to gain about 40 pounds over the past 2 years and led her into a depression that she simply won't treat. As she arrives at the office, she notices how busy we are, and this further compounds her stress. We ask, "How can we help you?" "I'm here for my appointment. My name is Sally." Now, she already knows what she owes us simply because we're kind enough to call her and let her know the testing is being applied to her deductible. More on this topic later. We call her back and compliment her on her glasses. "Wow, we love them." This makes her smile and helps bring her stress level down. We bring her to the visual field machine and check her blood pressure at 165/97. You perform a visual field, an OCT of the nerve, a photo, a pachymetry. Now, let's take a step back here and explain two perspectives. We got the patient experience, which is really most important, and the examiner's experience, or the doctor's experience. Now, the patient experience is a sense of anxiety with the unknown and the unfamiliar. Now, as the examiner, try to sympathize with this. A simple explanation of the test may be helpful, but most importantly, listen to them with a sense of compassion. Allow them to vent as necessary about whatever is troubling them in life, because you may be the only one they can open up to. As the examiner or the doctor, we are trying to improve the reliability of the test, complete the chart note, demonstrate compassion, educate the patient, etc., code the exam. List goes on and on. So, how can we prevent blindness from glaucoma for Sally, while at the same time inspiring some sort of positive change in her life? Well, it takes a highly trained SEAL team. So the super tech questions are, first, what does that visual field tell us? Is it reliable or unreliable? Outside normal limits, within normal limits. If it's unreliable or outside normal limits, return the patient to clinic for another repeat visual field, and you're going to add unspecified visual field defect and unspecified vision loss. Feel free to go ahead and let the patient know that this is necessary, and we'll schedule at around 4 weeks or later, to help with insurance coverage. Now, in the case of Sally, she would not shut up about her kids and how much she loved her new glasses. That caused the visual field to be totally unreliable. So our awesome super tech went ahead and rescheduled at 4 weeks. Now, what does the OCT of the nerve and the photo tell us? Well, it simply measures the living cells within that nerve. Now, questions are those nerves symmetrical? Do you see any notching? Are there any focal narrowing on the rim? Does the RNFL analysis follow the ISN't rule, inferior, superior, nasal, temporal? Do you see a disc hemorrhage? In Sally's case, she had a superior thinning in the right eye. Now, what does the pachymetry tell us? It measures the thickness of the cornea. Remember one number, 555 nanometers. If the number is higher, yay, lower risk. If the number is lower, whoa, high risk. Now, as a super tech, it is important to flag, highlight, scream any concerns to the doctor that you find on any of this testing. Studies consistently show this improves outcomes. In Sally's case, our super tech screams to Dr. Super's hero, visual field is unreliable, and we went ahead and rescheduled her in 4 weeks. She's a little bit thin on the top of the nerve, and she has some thin corneas. There's no family history of glaucoma. Oh, and by the way, she loves her glasses. So Dr. Superhero examines Sally with total awesomeness, because the coding is pre-done, and the super tech gives the doctor the BP, the IOP on eye care, and states all the previous findings when the doctor is behind the slit lamp. Sally thinks, wow, this SEAL team is awesome. So Dr. Supertech performs the IOP with attention to making sure the pressure is not 22 millimeters of mercury or higher, and gonio with attention to pigmentation. As slit lamp is performed, the anterior lens is examined for any exfoliation, and the corneal endothelium is examined for any pigmentation or Krukenberg spindles. Now, in Sally's case, her IOPs were 12 and 13 in both eyes, with a little bit of pigmentation. Very minimal. So, does Sally have glaucoma? We don't know. We know we have some high risk factors, such as thinning of the optic nerves and thin corneas. So let's have her back. Let's check the IOP again. We'll repeat the visual field, do a VEP, ERG, and an OCT. Now let's stay tuned to see what happens to Sally.